Hey everyone and welcome back. In this video, I will present to you the 9 symptoms of borderline disorder so that you can be more aware of this disorder and maybe recognize it in someone you know. Here they are. Desperate efforts to avoid real or imagined abandonment. For example, the person tolerates breakups with extreme difficulty, has a tendency to call or email their partner very often, endures postponements, delays, and refusals with anger and pain. They will very frequently have jealous rages, with multiple accusations for the slightest real or imagined violation of expectations. They will very hardly accept the end of a relationship, sometimes insisting for months or years with phone calls and messages. An accumulation of intense and unstable interpersonal relationships, characterized by alternating extremes of idealization and devaluation. The person frequently alternates in relationships of friendship, love, and therapy between moments of maximum emotional outpouring, in which the other is wonderful, perfect, the best, and then if they feel a rejection or believe a breach of expectations, they react with anger, arguing that the other is the worst, evil, beastly. They may impulsively decide to break off the relationship only to reverse their decision a short while later, arguing the opposite. In general, life and people are seen in black and white. Identity disturbance, marked and persistently unstable self-image or self-awareness. The person may have frequent moments when their view of self is an extremely negative one, sometimes going as far as self-hatred and feelings of complete worthlessness of their own existence. This alternates with moments of pride, of strong belief in the rightness of their own opinions, possibly with devaluing or ironizing others. Opinions about what matters or what they want to achieve in life are changeable. The person is convinced at all times of the permanence of the current decision. Impulsivity in at least 2 areas that are potentially harmful, for example, spending, sex, substance abuse, reckless driving, or compulsive eating. Impulsive and sometimes compulsive unprotected sex also occurs often in both sexes and can lead to contracting serious diseases like HIV, hepatitis, and so on. The person resorts to such behaviors as a mechanism to soothe extremely intense and painful emotions, to alleviate the pain of abandonment against boredom and inner emptiness, as an expression of hatred towards oneself or others, or on the contrary, as an expression of self-determination. Repeated suicidal or self-injurious behavior, gestures, or threats. The person often felt psychological pain and negative self-image. The person may often associate major depressive episodes. Interpersonal relationships can be severely affected by these permanent dangers and life emergencies, and it is difficult for partners, parents, and therapists to continue relationships in such a dynamic. Self-harm can be impulsive, done on the spur of the moment to soothe psychological pain, to wake up a reaction when the psychological vacuum is too terrifying, or as a method of self-control in the face of psychological and relational instability. Affective instability due to marked mood reactivity, for example, intense episodic dysphoria, irritability, or anxiety, usually lasting several hours and rarely more than a few days. Mood reactivity is one of the most distressing aspects of BPD because even emotional reactions to ordinary stimuli are extremely intense hot, the intensity of emotion reaching the maximum temperature very quickly. Their duration varies widely from hours and days to weeks and can sometimes warrant an additional diagnosis of major depression or anxiety disorder. Association with bipolar disorder or cyclothymia is common. Chronic feeling of emptiness. People suffering from borderline disorder frequently describe this feeling of inner emptiness or emptiness as a complete lack of internal emotions, sometimes so strange and unbearable that they may resort to self-mutilation as a form of feeling something. Other times they describe the condition as a feeling of profound boredom or a lack of meaning in life, stemming from a "I'm not okay, others are not okay, life is meaningless" life stance. Intense, inappropriate anger or difficulty controlling anger. Frequently, abandonment, rejection, or disappointment of expectations provoke extremely intense states of anger, for which justifications come in waves until the anger reaches a peak intensity. Sometimes it leads to verbal or physical aggression, smashing of objects, and other destructive acts done impulsively. But it can also be expressed through self-aggression, either self-mutilation or engaging in acts that are aggressive towards oneself, like taking drugs, dangerous sexual acts, or compulsive eating, paranoid ideation, or severe transient stress-related dissociative symptoms. As a justification for anger or devaluations of others, moments of paranoid ideation, sometimes of psychotic intensity, may occur with short duration and quickly subside. At other times, dissociated phenomena occur with feelings of derealization or dissociation, as if I was no longer myself, the world was disturbed, I felt as if I was watching myself from the outside, etc. I hope that you found this video helpful, and thank you so much for watching. Take care of you or find someone who does.